Okay, welcome back to the Founders Table. This is where we sit down with leaders who are shaping industries and their communities. Today, I'm joined by Kyle Mead, the president of Heartland Center for Behavioral Change, a nonprofit organization that's been helping Missourians overcome addiction and rebuild their lives since 1982. Kyle's leadership has guided Heartland through a mission of hope, healing, and recovery, providing behavioral health and substance using treatment services that have changed countless lives. So I'm very excited to dig into how this organization continues to make a real impact every day. Kyle, thank you for joining me today. I think it's going to be a really, really great episode. The first question I do want to get into is kind of into your background. So you've been at Heartland for over 2 decades, have worked your way up through multiple leadership roles. What first inspired you to get into behavioral health and addiction recovery as work?
Well, it's a great question, Tony, and thank you so much for giving me the opportunity to talk about this. The reality for me is that I did not go to Heartland Center for Behavioral Change with the idea of creating a career. I'm a person in long-term recovery from substance use disorder myself. I was looking for an opportunity as I was going back to school, and somebody told me that they were hiring down at this place that was doing reentry services for people coming out of prison back into the community. And so I literally did start my career there at an entry level position, but I fell in love with the mission of the organization, and I started gearing my education and my training and everything else towards what we were doing, because I just really believed in the idea that change is possible, recovery is possible. People do deserve to have that opportunity to be able to create the life for themselves that they want. And I truly believe that the organization was working towards that goal primarily. And so, like I said, I didn't necessarily mean to be there, but it'll be, I think, 26 years in November this year that I've been there. And I hope to be able to stay until the day I retire.
That's crazy. That's a long, long career. I love the mission behind it. Was there like a defining moment that made you realize you wanted to lead in an organization like Heartland?
I think for many people, they go into behavioral health, and especially while you're still going to school, and people tend to think about clinical roles. And so I see that very commonly, and absolutely that's great. Thank goodness for those people. But I do think that I identified fairly early on that my strength really wasn't in direct care services, that it really was on the administration side, that it was in the system building side, not necessarily knowing that going into it, but um, I recognized that fairly quickly. And so my opportunities to advance within the company very much appreciated, but it took me down a pathway of corporate compliance and regulatory components. Particularly when the Affordable Care Act came into play here in the United States, it changed a lot of things for us as an organization to really recognize our role in the behavioral health system of care. And I really took an interest in the corporate compliance aspect of things, and made myself, a expert in the regulation associated with substance use disorder and behavioral health services. And so I would say that that was the point at which that recognizing where my strength lies and having the opportunity within our organization to be a part of that was probably that defining moment.
Okay. And you're right. I feel like a lot of people definitely typically do go down the clinical route. At least I feel like when they're starting, at the beginning of their career paths. I don't know a lot of people that do end up going the corporate compliance route. So that is a very interesting pathway. But obviously, it's led you to great success. I have to believe that you being there for that long, developing your whole career there, there's definitely probably a good culture. There's definitely probably a good company behind everything that's going on. And that clearly shows if you're willing to spend 2 decades there.
Well,
So,
and a lot of credit for that goes to the leadership before me too, building that. There are a couple of things. Like, I just did a new employee orientation yesterday, and I'll share with you just this little piece about what I talk about to the new employees. Is that when I started there, we had to do pat searches of people. We had a residential facility, and people were coming about 175 people were coming out of prison and into the community every single day there, and they were going out and getting jobs and finding apartments and taking care of the things that were stipulations associated with the probation and parole. And so we had to pat search people when they came into the facility. Well, I'd never done that kind of work. I didn't have any law enforcement background or correctional background or anything. And I really recognized what an intrusive thing that was. Well, when we had trainings and things there at Heartland Center, we focused in on how do we do this in a way that respects the individual person, that shows that human dignity for that person, understanding that what we were doing, while necessary for accountability and safety for everyone, was still a very intrusive act. And so we stayed very focused on the people that we served and having an understanding that the work that we were doing was not always easy. It was necessary, but to do it in a way that never took away the personal dignity and respect for the people that we served. And I think that's what really made me fall in love with the mission of the organization. That was such a big part of the culture of what we built there.
Love that. And maybe this dives into my next question. Because behavioral healthcare, it is really such a mission-driven field, right? What motivates you the most about this kind of work?
Well, I'm a very data-driven person, and so we spend quite a bit of time looking at our data. I'll give you an example of a situation that came early on in my tenure as the CEO. Is that we started looking at the data around our withdrawal management services, and so this is very crisis-oriented, and quite frankly, stewardship of taxpayers' dollars is incredibly important to me personally, and it's a very high cost service because you have a medical director and medical staff associated with this withdrawal management service, and it's very crisis oriented. And it's almost embarrassing for me to say this, but when we started really looking at the data for whether or not people went from withdrawal management into the next level of care, if there was that continuation of care, much like there is in primary health or in mental health, there, it doesn't always stay at the crisis orientation. And you want to stabilize a person to get to the services that they need, but are also more cost effective for that individual. And so we were seeing that only about 4% of the people that were coming through our withdrawal management program were entering into the next level of care. And that was just absolutely unacceptable to us. It's just like, what are we doing wrong here? And what we realized was that so many of the people that were coming through our programs were homeless, and they were living on the streets. And so here we were saying, we'll come back a week from Tuesday to get your intake appointment for outpatient care. Well, that was ridiculous for a person who didn't know where their next meal was coming from or where they were laying their head. So we opened up a facility called the Community Residential Unit, and we addressed that need. And this month, I still find it not a good enough number, but we hit 48% of the people that
Wow.
came through our crisis-oriented care. And so from 4%, that's a great improvement, but I'm still driven
Huge.
very much by how do we continue to go further than that? Well, the success in having people come, particularly parents that show up and say, I got my kid back as a result of their treatment services that you had here. And we only serve adults, so we're talking about adult, people, but their
Mhm.
parents are just, so grateful for the opportunity. Those are the things that motivate me. I love seeing the numbers change and see us drive data that shows that the work that we do makes a difference. And then I love hearing that personal anecdotal experience that family is being restored and regaining a healthy relationship. Those things are overwhelmingly important for me.
I love that. And clearly, I mean, you can just tell in the voice and how you talk about it is that obviously no one will deny that you're very passionate about the role that you play in the organization. So I'd love to get more into Heartland and its mission. For those who may not be familiar, can you share what Heartland Center for Behavioral Change does in the communities you serve?
Yeah, well, and that's interesting as well because it changed so much in 2012. I think for such a long period of time, and quite frankly, when I came to work there, I thought of us more as a social services type of an agency than a behavioral health organization. I didn't realize the role that we played there, but in 2012, when that Affordable Care Act came into play, we really embraced that role as a behavioral health organization. And so our mission is to provide behavioral health and substance use disorder treatment services for individuals to lead healthier, happier, more productive lives. And sometimes that stuff is kind of hard to, quantify or to put numbers around. How do you measure happiness? Sometimes those are difficult things to do, but our mission is to be able to offer a fully comprehensive, accessible array of treatment for individuals, no matter who they are or what they've ever done in the past. We still work with a lot of people who are criminal justice system involved, and that really is a testament, because sometimes those are not the easiest cases. A lot of times when the person arrives to you because of somebody with a badge or a gavel sent them, they didn't necessarily come there because they wanted to be there. And so sometimes outcomes are difficult to obtain, but we do offer that withdrawal management at that crisis oriented level of care. We offer that intermediate community residential unit that I made reference to so that we can make sure that other treatment services are accessible. We have residential treatment programs that can go anywhere from 30 to 60 days on average, probably, for individuals. And then we have a full array of outpatient treatment services as well. We do have that niche market in the criminal justice system involved persons arena. So we do a lot of work with drug courts and DWI courts.
Okay.
That's a big part of what we do. And we have 12 clinics spread around between Kansas City, Missouri area, some of the suburbs, and then also down around Springfield, Missouri, and some of the rural communities around Branson and Bolivar, Missouri, which are really difficult communities to serve because they have so few resources. But we really embrace that role that we play in those communities, and we try to offer evidence-based practices that are recognized by SAMHSA, up to and including medication-assisted treatment services for people. And so really proud of the system that we build, and really proud of the fact that we work with so many other sister agencies in those communities to make sure that we have an integrated care type of a model. We want to
Mhm.
recognize that there's physical health and mental health and behavioral health, and that they all have to work together in order to help people achieve the goals that they have for themselves.
I love that. And you guys definitely have quite the setup for yourself. You definitely have a wide variety, I feel like, of things that people on the outside necessarily wouldn't even think of, like that people would need help with these things, you know? So it's like, it's good that it's very, from someone who's not within that industry whatsoever, just hearing about all these different things, it makes you really think and really appreciate the people that are out there doing these services for people who actually do need them. So I think it's amazing. The organization has been around for more than 40 years. I'm curious how the mission evolved to meet the changing needs of the people you served, if it has.
Yeah, it definitely has. Our founder was a lady named Shirley Johnson, who also had a substance use disorder, and she had been very involved in the Missouri Department of Corrections. And I think when she originally opened up that first facility at 1514 Campbell, I think she was looking to provide a place of refuge and hope for individuals who were chronically homeless, chronic inebriates, people who were in and out of the criminal justice system on a regular basis. And in many ways, I think it took time for Heartland Center to recognize the need to embrace some of those evidence-based practices and to embrace a medical model of care and services, and to recognize that there was more to this than just providing three hots and a cot type of an approach. And
Hmm.
so she laid that foundational work, but the evolution of time, of the history of the different leadership and the people that embraced those and some of the governmental regulations that came into play and just provided opportunities for us. Some of it was very natural, but it was also those things that we embraced, that we said, hey, this is something that we're good at and that we can do. When I first came into a leadership role there, one of the things that we were doing was a lot of work inside the prison systems within the state of
Interesting.
Missouri. And at one point, I actually took the time to say that I didn't think that that was the right model. And the CEO at that particular time listened to me, and they were very, very difficult to do. And quite frankly, I felt like we were spread too thin, and I thought it was harming our reputation sometimes that we were spread so thin, and we didn't have the opportunity to have the administrative oversight that I felt like that we really wanted to have, and we wanted to be a center of excellence. And so it was actually necessary for us to contract a little bit and not be spread so thin, and to really focus in on who we wanted to be and what was important to us as an agency, and that really boiled down to the community itself. And so we got out of institutional treatment almost completely, and really embraced that model of being a part of the community.
I love that, and I like the aspect of recognizing when you've been spread too thin, because I feel like a lot of people, whether it's in non-profits, whether it's in for-profits, businesses, things like that, but like spreading yourself too thin is definitely a thing that a lot of people do, especially more so ambitious people as well. When you have a big heart, or when you have like a big goal or thing that you want to achieve, it's natural to want to give as much as possible, right? There's nothing wrong with it, but then you realize it can kind of more so hurt, like you said, your reputation, or even how you fulfill what you've already promised to fulfill when you start spreading out too thin. So that is amazing that you kind of navigated that and kind of brought that up. Is that a thing? This is more a spontaneous question. Is that a thing that typically does happen with like nonprofits? Is like spreading yourself too thin a commonality, or?
Well, I think it does happen too much. I know we get a lot of pressure. I have a lot of relationships with people in our local governments that oftentimes are wanting to deal with people experiencing houselessness, and that homeless population is one in which I have a heart for it,
Mhm.
but it's not part of our mission. And there are other organizations in which that dealing with homelessness is specifically part of their mission. And so one of the things that I try to do as a leader in our organization is to always bring it back to our mission. And while I understand that a lot of the people that we serve are experiencing homelessness, but I don't want to compete for limited dollars against other nonprofits that are trying to do that work. And I want to be supportive of them and their efforts and make sure that what we're doing is staying in our lane.
Mhm.
And I think that's so important, because anytime that there is an overlap in those service structures that isn't well managed, what we end up with is poor stewardship of dollars, whether it's charitable giving dollars or it's taxpayer funded dollars. We want to make sure that we are not duplicating services, that we're not acting in a way that is irresponsible for what the community is asking for us as nonprofits. It comes up a lot in our recovery support community, which does an absolutely amazing job at what they do. And I really want for Heartland Center as a treatment provider to engage with those recovery support community providers in a way that says that we're referring people to you who have received their treatment services and display stability to be effective in their programs. And I don't want to be having recovery support community providers that are out there trying to take the place of treatment. We all play a role and we all have a place. And when we do a really good job, our outcomes can be absolutely amazing. But it does take work, and you do have to manage it, because your heart might tell you that you want to find a way to say yes to every request that comes out there. And that's not always the smartest move.
Yeah, no, I think that's incredibly true. And my mind goes back to business, because I'm in business, and when you bring that up, I think of um, like the structure of a team, right? Everyone plays an important part, and everyone's really good at their role. But when someone starts going in someone else's role, it can be for great intentions, but sometimes it doesn't always lead or yield the best results from it, because you have to let who's good at that. Let them do what they need to do to be good at that, and you do what you are good at. And then when you do it together, when those outcomes come happen or align with each other, then you start seeing real results and real change, I guess, in the industry that you guys are in.
Yeah, yeah, I thought it's a really good point, and you're absolutely right. You when you're dealing with individuals, whether it's the workforce or the people that you serve, they all have their own strengths and weaknesses, and we have to be able to maximize where their strengths are, and then find those ways to fill in the gaps. And
Mm-hmm.
it's really important to recognize that. And it's also it creates that whole other problem when someone does leave your organization for whatever reason. It's not always easy to replace because that was an individual in a unique circumstance. And so
Right.
how do you go about doing it? It's amazing how often that it feels like it takes two people to replace one.
So I want to touch on, because I was still on Heartland. Like, I'm curious, what are some of the programs and initiatives that you're most proud of today?
Sure. I think right now, one of the things that I'm the most proud of is that Heartland Center was invited to the table around a disease management model here in the state of Missouri. And so, they were doing is the Department of Social Services was really looking at the high utilizers of Medicaid dollars. And what they were recognizing is that so many of those individuals were accessing emergency room services as opposed to primary doctor care visits. And they were aligning those up with individuals who had mental health diagnosis and substance use disorder. And so we will, on a quarterly basis, get a cohort of people that we know almost nothing about other than their names, and we can look at their Medicaid uh, payment history and kind of see what area of town maybe that they're in. And then because we have these amazing outreach workers who know our community so well, they go out and they engage with those individuals, and they offer them assistance in order to be able to get them more in line with a traditional healthcare approach for chronic conditions that this person has. It's incredibly difficult work, but it is saving millions of dollars. And that's not even the important part. The important part is that it's improving the quality of lives for these individuals who maybe just don't know how to access health care
Mm,
appropriately, mental health care appropriately, how to do that in a way that is not always on the crisis oriented aspect of things. And so these individuals will literally hold these person's hands through the process of getting a primary care physician, of getting um, assistance in terms of medication management and making sure that they have all of the things that they need in order to be able to take their meds. When you're talking about a homeless person who has insulin that needs to be refrigerated, you've got a serious issue and a problem to be able to
mhm.
address. But when you address that, what you do for the quality of that person's life is just unbelievable. And that particular program and being a part of that, it has just been very rewarding for us. We've seen ongoing growth, and our outreach team are just people that I'm just so impressed with. They show up and they go out and they literally walk into homeless camps and create relationships with people and provide opportunities for them to access care and services in ways that I never knew of. This happened almost without my permission. It didn't take any of my leadership. It was the vision of other people that really my role was to stay out of their way and watch the amazing work that they did. And I'm just so proud of where they are right now. I know it's making a big difference in terms of dollars and cents, but it's also making a big difference in terms of quality of life.
I love that. And it's one, I want to get into your teams and workforce a little bit later down as well, because I would love to touch on that a little bit more. But going into like growth and operational challenges within like Heartland, for example, running a nonprofit in behavioral health, I feel like comes with unique challenges. And granted, I'm not an expert on the industry whatsoever, just from research that I've done, from funding or to like staffing compliance. What have been some of the biggest hurdles in maintaining, I guess, sustainable growth in this field?
Wow, yeah, you're hitting on something that is like an area that I feel like is not where my strength lies, and as an agency, it's something that we're trying to address right now. So we've been a 501c3 for a long time, so we've always been available to be able to have fundraising and charitable giving, but we've operated for the vast majority of our 40 some odd years in business working on government contracts.
Hmm.
And two things about that. One is it's not guaranteed. And so, and the rates don't go up to match the changes in workforce cost and insurance cost and other things. Those contracted rates are really good for the government, but they're not always good for growth and for opportunities to expand from a business standpoint. So you have to look for other models. And so diversification in your funding streams, I think, is really important, but it also says you've got to go out and sell yourself. And that means doing some fundraising and some marketing. And these are things that we had not, one, had a historical presence and knowledge in. And number two, maybe didn't feel the same pressures that I feel today to be able to do those things. And so we literally just held our first annual golf tournament fundraiser.
That's amazing.
And yeah, and it didn't bring in a huge sum of money or anything, but we're going to purchase a vehicle with the money that was raised in that
Hmm.
golf tournament. We had so much fun and we got our name out there in a way. And I hope that it builds some momentum and that some of the members of our team that volunteered to be a part of this and to participate in it will recognize that if we start building a presence in our community and people learn more about who we are, that their willingness to donate and to provide money and for us to fundraise to be able to have expansion and growth will just be a really positive thing. The reality is we still are mostly responsive to when the community says something. And I think Missouri is an amazing community and they are very innovative. Our Department of Corrections and Department of Mental Health work together on initiatives all the time. And when those opportunities come, what I always hope is that Heartland Center's reputation gets us a seat at the table so we can talk about how we can help make that vision a reality. And we've been very fortunate in some of those areas as well. Like I mentioned, the disease management, but there are some reentry programs that are out there now that are allowing us to actually assist people with tools and funding for housing and for other things that can help them in regard to their stability. There's some integrated care models where we work with federally qualified health centers to make sure that people have full access for primary health care services as well as their behavioral health care services. When those models come up and when people have a vision around it, Heartland Center raises its hand and says, yes, we'd like to be a part of the conversation. And if we can be a part of the funding source to be able to do that work, we think we can do it and do it well. And so
Love that.
that's kind of the way that model has been for us in terms of opportunities for growth is looking at the vision of others in the community and saying how can we be a part and does it fit for us in terms of
Mhm.
our mission.
I love that. And I got to say, on the golf side of stuff, listen, and whenever you guys host another golf charity event, please send me an invitation. I would love to come out. Love playing golf. I'm not underneath 100, but I'll come out and still swing a
Oh,
couple clubs around.
you can play on my team then because I don't break 100 very often, very either. But man, did we have fun doing it? And like I said, we raised enough money to purchase a vehicle that is
That's
going to
awesome.
help our outreach team. So we're really looking forward to doing it again. Yeah.
Love that. So, my next question on this is, how do you approach balancing the mission-driven side of the organization with, quite frankly, like the operational realities that come with managing resources and staff? Because I feel like a lot of people, when they think of it, you know, people are only looking at mission-driven side, and in reality, there's obviously things that happen on that are just real life, like finances, like we were talking about, marketing, things like that. Like, how do you balance that?
Well, my pathway to the leadership of this organization, which we kind of hit upon a little bit early, but when I sit in the room with the other CEOs, I am one of the only people who doesn't have the licensed clinical social worker, or licensed professional counselor, because I didn't take that clinical route. I definitely recognize that my pathway to leadership in this organization was different than many of the other CEOs and the leaders of the other just amazing organizations that we work with. And so, one of the things that for me that I had to recognize right away was I need to get the right clinical team in place. And so, in 2019, I was very fortunate. I was the vice president of behavioral health services because the CEO at that particular time saw what I was bringing to the table and allowed me to do it. But I always felt weird about it. I always felt like I wasn't truly qualified to be in that role because I didn't have that clinical background. And so when I got the opportunity to become the CEO, what was really important to me was that I hired a good quality clinician that had that leadership skills and abilities. And so we had a program manager here, a lady named Shauna Drake, who was a licensed clinical social worker, and she had been incredibly successful as a counselor and then a manager. And then I ended up naming her the vice president of our behavioral health. And through some growth and some other opportunities, we had another young man named Casey Sparts, who is just an amazing human being, but he's also one of the smartest people I've ever met in my life. And I doubt this guy is in very many rooms where he's not one of the smartest people in there. And then he comes from a very heart and clinically sound place. And he earned his master's degree and got his clinical social worker licensure while he was an employee with us. And so we promoted him over to the vice president, and now Shauna's over residential and Casey's over the outpatient side. Well, what that meant for me is that I knew that I could get out of their way. I had talented people around me that could run their departments and could do those things in a way that wasn't going to require a lot of oversight from me. I certainly want to be available to them and support them. And I do have historical knowledge because I've been with the company for such a long period of time. But that's been the key for me, is hiring really, really good quality people and then hopefully treating them well enough that they'll stay with us to be able to watch them grow. They're just absolutely amazing, and what they've been able to do for us and bring our agency forward is truly phenomenal. And it's them more than it is me. I can tell you that for sure.
And you somehow perfectly segued into my next question here with that. Because my next question was going to be, teams and the people behind the mission are obviously the most important, as we've been talking about. And what I was going to ask is how important has building the right team been for the organization's success? I guess if you don't want to touch directly on a leadership sense, maybe on a little underneath them as well, like how important does that go down, or how important is that whole process for you?
Well, it's incredibly important for me, particularly amongst our executive leadership, which is basically a 5-person team at Heartland Center. We're about $18 million a year in revenue, so we're pretty small for a behavioral health organization. But our director of finance and accounting is a member of our executive team, and that person's ability to build a team of the people involved in accounts payable and accounts receivable, the billing and the complexity of billing when you have a diverse funding stream can be a real challenge. And so that person's ability to build that team out and to stay in their lane and what they do is incredibly important. And then human resources, and our director there is the other member of our executive team. And that person's ability to recruit, hire, maintain benefits, and keep us competitive in the marketplace in terms of hiring the right people. And especially when you have that large geographic footprint, even though you're not that large of an organization, it creates complexity and challenge that requires her to have a really amazing team of people as well to do that. And so I think that's really been the key for me is allowing the different departments to build their team, to put trust in the individuals, and then to not get in their way, not be a hindrance to them, and allow them the support and the guidance to be able to do their part. And then watching them all come together. We
Hmm.
do it as a risk management strategy. We come together every 2 weeks, our entire executive team, and we have specific things that we're reviewing, whether it's health and safety or corporate compliance or quality assurance. And that's how we operate. And we all work together to be able to do that from within the scope of our team. And I do think that that's been really important for us as an agency to operate that way. We work together, but we're very careful not to get in each other's way or get into each other's business, you know.
Right. And that goes back to just, letting people who are good at what they do what they need to do. At the end of the day, like how we are talking about earlier, especially when it comes to either organizations or on a team's sense. And it sounds like the main thing I got from that was for anyone listening that is in roles where maybe they're struggling to like get their team to perform the way they want them to perform, is just stay out of their way. Like let them do what they need to do at the end of the day.
Yeah. I gave this example once before in another situation, but I've always been very interested in sports and athletics, and I want to be respectful of your time. But I was doing some football officiating. When I first started doing some football officiating at the kids level, I had this epiphany that happened for me. And those first couple of years were really challenging. You had to stay very focused on the ball all the time. If you ever lost sight of the ball, it was a very uncomfortable feeling as a football official. And
Hmm.
so the coach would be in my ear going, "Didn't you see that holding that was right there?" And it probably was right in front of me, but I was so focused on the ball that I honestly didn't see the holding. And so now the parents and the coach and everybody.
Yeah.
But what I noticed is that over time, your field of vision started to grow, and you
Huh.
started to be comfortable being out there on the field, and you could monitor and administer way more of the field and the game as you learned, and you became more comfortable, and you didn't have to be so focused on the ball, and you became a better official.
Hmm.
And I liken that a lot to building a team within our work. That a lot of times you bring somebody in and you move them into a position. I know this was true of me, that I honestly was not really ready for oftentimes. I did not have the preparation and the skill set. But if I was given the time to give them some comfort, then suddenly my field of vision would start to grow and I would see the bigger picture a lot better. And I became a better leader because of that. And it's the same thing. So when I move somebody into a position, when they get promoted from manager to the vice president, for instance, the workload is overwhelming. And so I just want to be supportive of them. And I want to give them time and to recognize that they may need to be very focused on the ball for a little bit. But if I give them enough time, that field of vision will naturally start to grow and their ability to see the big picture will come with it. And I think that's true for most humans.
Yeah, no, that's a really really cool analogy. I've never heard that before, so it's 100% unique to you. But like that is a very very cool analogy. I'm definitely going to use that because it is true. You tend to, especially when you get into new things that you're doing, whether it's new work or anything, you have a tunnel vision that happens because everything you're not quote unquote experienced with it yet. So it's like everything is brand new and your brain is working at 100% occupancy to like get this going. And then next thing you know, it's like, okay, well, I don't have to put as much energy to get the results I need to here. And that's when I feel like that field of that vision opens up more. Love that
Yeah,
analogy. I'm going to use that 100%.
feel
Um,
free.
on the team stuff, I almost lost my questions here. I want to continue on the team. So, like, what are some of the challenges you face when it comes to hiring or retaining qualified like behavioral health professionals or just people in the team in general? Because and granted I don't know too much about the industry, but I feel like if it's similar to other like industries in itself, that there is a sometimes a struggle with trying to keep staff there, whether happy or culture going. So if you please feel free to elaborate or enlighten me on that.
Yeah, well, it is absolutely a very difficult thing. There are certain professions that are out there that I think as we're kids that we kind of grow into that we know that there's some prestige associated with that position, that there's some monetary rewards that come with certain positions. And so you get a lot of people that think, I want my kid to become a lawyer or a doctor or something along those lines. You don't hear a lot of parents talking about, well, I want for my child to become a drug and alcohol counselor or a licensed clinical social worker, because those are not positions that get a lot of attention. They don't get a lot of praise. And quite frankly, the pay for those positions, particularly in the nonprofit field, is not always the most competitive. And so it is a real challenge. And I do think that when we look at institutions of higher learning, we are seeing a lower number of people enrolling involved in counseling professions in those. If you wanted to become a psychiatrist right now, the opportunity for psychiatry is just unbelievable. They get about 7 minutes per patient because of how busy the average psychiatrist
Wow,
is. 7 minutes per patient.
that's
It's
insane.
unbelievable. And so this, for whatever reason, in this field, we have not always been that identified thing that kids might strive to. So we have to find unique ways to attract people into this field. And one of the things that happens is that people who find personal recovery
Mm,
oftentimes want to give it back. To be honest with you, that particular population, which is my people and people that I love, don't get me wrong, but there's usually an educational deficit.
mhm.
And so we have to find ways as an organization to build our workforce from within. Excuse me. We put a lot of emphasis on training. We'll pay for people to gain their credentials. We'll pay for people to be able to advance in their training towards those credentials. We can do some tuition reimbursement because we're a nonprofit. We can participate in different programs that allows for some tuition reimbursement, but obviously we can't cover the cost of those the way that some other organizations maybe can. But we can be supportive in terms of the hours that we have. If a person has a requirement for clinical supervision that costs them money, maybe we can help out with some of the cost associated with that. So we really want to put an emphasis on our staff that come in at line level staff. The CEO there came in as a line level staff making $7 an hour when I first started working there,
That's a story in itself. That is
years
definitely a
ago.
hiring story right there.
Right. And so we want to make sure that that culture and that opportunity for internal advancement is there and available for people. And we want to support people in being able to do that. And so we build our leadership team. Oftentimes, we're able to promote from within and give people
Mhm.
those opportunities. I think that's what gives us longevity, where we have people who stay with us for multiple years. And I think it's also how we make sure that people are trained in a model that matches our culture.
Right. And so, on the last section, I guess on teams, like, well, you did actually just kind of answer that. I was going to ask, like, what have you found that works best in creating a culture that keeps your team motivated and aligned? And I feel like it is just grabbing the people from within, because that when you get people that are obviously they've joined because they're mission driven, and now that they can increase their mission driven mindset by expanding their roles within the organization, it's just that's in when I think of it in my head logically, that's the best way to create or maintain a culture in that sense. Unless you have anything to add on that.
Well, I think the other things that have happened over the last few years, particularly post COVID, when hiring became incredibly difficult, and
Mm,
some of this might seem like why weren't you doing that before? But we developed an employee morale committee, and so we have some fun events that people do in which that they can win some prizes and things from different things. We look at that from a health standpoint too, and we do a lot of work with our insurance broker, and we'll do contests and things. We try to have a very diverse workforce, and so like we have an event coming up in which that we're going to ask people to bring food that is culturally representative of them and their families and
mhm.
bring it and
Love
share it
that.
with others so that we can learn more about each other's culture. I think those are some of the things. Having a newsletter where we take the time to really congratulate and notice when somebody achieves a new credential. Or recently we had somebody who worked really, really hard to get their bachelor's degree. This was not an easy thing for them, but we try to make a really big deal out of it and really praise them. And because our organization has that geographic footprint, sometimes the staff don't always know each other particularly well because they live literally hundreds of miles apart from one another and don't work in the same office. And so by using newsletters and other means of communication, we can make sure that we are honoring each other and allowing people to get to know some of their coworkers that they otherwise wouldn't, by celebrating their achievements and their accomplishments.
Love that. No, I like the culture, the food aspect, like bringing in something that's resonant to culture, because I think a lot of people would love that. Um, as we go to the last couple of questions here, so looking ahead, we're at the end of 2025, going into 2026, which isn't crazy to say. Um, what's the biggest goal or initiative you're excited to focus on in the coming year?
Well, it's interesting that I gave that example of contraction before about working in institutions, but Missouri was one of the few states that have received what is called an 1115 waiver. And what that is a Health and Human Services guideline that says if you provide institutional treatment services, you can only house about 16 people in the same facility. And so that was very restrictive. By getting that waiver, we were able to do some expansion. Well, there's another piece of that that really looks at incarceration
Hmm.
and those individuals that are in incarcerations, and some of those rules prevent, in some ways, some of the traditional funding for people. And so there's an opportunity here that we think to provide medication assisted treatment. So Suboxone for people with an opioid use disorder, or buprenorphine. We can do Vivitrol for people with opioid or with alcohol use disorder. And so one of the things that I'm hopeful when this waiver gets completed, the Heartland Center will capitalize on our relationships with the Department of Corrections and local jails and institutions, and be able to go back into those institutions in a way that we will start to engage in treatment services for them, including medications, because that's such a high risk for overdose death for those individuals who have been incarcerated for any period of time. They come out and their tolerance isn't the same, and the risk of death from overdose and drug poisoning is so great. So we want to start to engage with those people truly in that reentry model. And I think that's going to create a lot of opportunities. And if this goes the way that I think it's going to, people who are incarcerated, who are going to come back into our communities, can get some limited access to even Medicaid dollars to be able to cover the cost of their treatment services, up to and including the cost of medications. And so I see that as an opportunity that it will save human lives, and really fits in our alignment with our mission and frankly our history and our culture as an organization. So I'm really looking forward to that, and really proud of Missouri for taking the time to recognize that need. We're one of the few states that actually showed a decrease in overdose deaths over the last 2 years. And
Love
so
that.
nationally, we've still seen an increase to some degree, even though it's definitely gotten better nationally. But really proud of the effort that Missouri has put in and the opportunities it's given us to help the whole country get over this opioid epidemic and move to a better place.
I will say before I go into this last question here, it's very because I get onto a lot of different podcasts with people in different fields, a lot of business owners or execs that are in for-profit businesses, right? So it is very refreshing. It's just a refreshing conversation to listen to a people first, people driven, like a mission driven initiative, as opposed to dollar driven. And there's not, granted, I'm in business. There's nothing. I don't mind dollar. I love dollar driven, but it's like hearing it is a very refreshing mindset, because when you're not in it every day, it's hard to recognize and realize that it exists and it's happening, right? That initiatives and those organizations exist. So before I go into the last question, one, I just want to say thank you for all the work that you do. Thank you for all the work that your team does and the organization does. And I'm sure you guys are going to have many, many more success stories and accomplishments on top of what you're already doing. But going into this last question, if you could give one piece of advice for any nonprofit leaders or executives listening, short piece of advice that you'd share about leading with purpose from building long-term impact, what would that be?
Listen to people when they give you their feedback. When you have that employee that says that they really need for you to stop by their office and say good morning every day, take the time to do it. It may not feel like it's the best use of your time. You may have a mission that you're on and you've got something else to do. But when people tell you what they need, listen to them, and then go out of your way to find a way to accomplish that, even if it doesn't necessarily always align with what you think is the most important and where your priorities might be. Listen to people when they tell you what their priorities are and what they need from you. What you'll get in return will be tenfold.
Love that. Well, Kyle, thank you for joining me today. If it's all right with you, I'd love to throw like your LinkedIn in the description if everyone wants to reach out or check out I'll include some of the organization's websites and everything in there too.
Yeah.
If that's all right with you. But yeah, thank you for joining me. The work you and your team do at Heartland are truly life changing, and your leadership clearly shows what it means to create meaningful and lasting impact. So I appreciate you taking the time to share your story with us. For everyone listening today, thank you for tuning in. Feel free to subscribe and stay in tune for future episodes. And we look forward to seeing you guys then.